Hello, everyone. Thank you all for joining us today. This is Jessica here with the Oregon Health Authority. I'm here to get us started and to fill the time as we all get situated and stable in this Zoom meeting today. We're so glad you're joining us. I think that this is a topic that a lot of people are interested in because I am seeing a lot of folks actively joining right this moment. So I'm going to spend a little time with us before we dive into the content specific for December 11th Allcom webinar. Um, and Damaris, if you can go to the next slide, we'll talk a little bit about Zoom in advance of talking about our 1115 Medicaid waiver here in Oregon. So the reason I have this housekeeping is because we have a lot of people in this virtual room together, and we want to make sure that we do our best to remain interactive while also not talking over one another, things like that. So we do have the Zoom chat, which is a really great tool to ask questions, to say hello, to let us know that you have thoughts on any of the content that we're presenting and to interact with one another as well. And so please feel free to use the chat at any point in time. We will also have space for people to raise your Zoom hand and to speak out loud if that would be another way that you're interested in interacting with us. We do have content to get through, so we're going to pick some time to be giving information to you and some time to be listening, and we'll do our best to do both of those today. We are recording today as well, so if you want to get access to this later or you want to share it with a colleague or friend, that information will all be on our public website shortly after we finish. We do also, the last piece of my housekeeping is that we also have live captioning today. So if you look at your Zoom toolbar, you should see an icon that has sort of a rounded rectangle and then two C's within it. And you can use that to pull up captioning or the full transcript today in order to follow along. There is a chance that might be hidden behind a sort of dot, dot, dot more button. I don't know about you all, but I just noticed that my Zoom has changed its look and feel dramatically over the past month. So if things are looking a little different than our previous Zoom meetings, or if you're having any trouble, also feel free to use the chat. And those of us who are not speaking can help to troubleshoot any technical issues you may be having. With that said, let's see here. I think we're starting to slow down the number of people who are actively joining. So we'll continue to let people in while we dive into our content. Next slide, please. And this is my final slide before I hand it off to some excellent folks who have a lot of information to share. So I will wrap up by letting you all know that we have a fairly straightforward agenda today. We're going to make sure we're all on the same page with some background information about Oregon's 1115 Medicaid waiver. And then we are going to spend most of our time talking about the health-related social needs nutrition benefits today and give key updates. And then also have time for questions and answers at the end. That said, I'm going to hand it to Steph for the next few slides. Thank you.
Great. Thank you, Jessica. Hi, everybody. My name is Steph Jerem. I use she, her pronouns, and I am the 1115 Waiver Policy Director. We could go to the next slide, please. Slide again. I'm just going to provide our standard background for anybody who is new to this webinar and just a friendly reminder for everyone else. So we are here to talk about the Oregon Health Plan. The Oregon Health Plan is what we call Medicaid in the state of Oregon. Medicaid is the nation's public health care program. Oregon Health Plan is free in our state. It is healthcare coverage. So this is health insurance for low-income children, teens, and adults who live in Oregon. People can apply at any point in time to determine eligibility. And as part of this waiver, you have a minimum of 2 years continuous eligibility. So if you go to the next slide, please. The Medicaid waiver is what we are here to talk about. It's what is allowing us to do all of the good work that we've spent years discussing here. The federal government sets the actual rules for how to deliver Medicaid in the state. If a state is interested in changing any of those rules, such as who is eligible, what benefits are available under the plan, or how we pay, those changes can be applied for through a Medicaid waiver. There are lots of waivers, but we are here to talk about the 1115 waiver. Next slide, please. So the key changes of this waiver are in 2 areas. The first is in expanded Medicaid coverage, meaning that more people in our state get to be enrolled for longer on the Oregon Health Plan. And so that includes continuous eligibility and enrollment for children up to age 6. So at any point in time, if a young child is eligible for Medicaid, they are just then on the program and eligible up through age 6. For everyone else, it will be 2 years of continuous enrollment. This is to really help with people who go on and off in a short time period. That's called churn. We really wanted to allow people to have more continuous care and coverage. And then coverage for young adults with special health care needs up to age 26. That is launching in January for young adults who are 19 and 20 years old to start. The second group of key changes to our program because of this waiver is expanded Medicaid benefits and services, including health-related social needs or HRSN supports, which include housing, which we've talked about a lot in this webinar series, nutrition, which we'll talk about today, climate supports, and outreach and engagement services. And both of those have gone live since March. There's also a limited set of services for people in a carceral setting. So that is jails and prisons, 90 days before they are released. And that will go live likely in January 2026. And then tribal traditional healing practices, which we also just recently got approval for. Next slide, please. A little bit deeper on the HRSN, so that's the Health Related Social Needs Program. These are ways to support people outside of the doctor's office in improving health and well-being. So the climate includes devices and equipment that can help protect against extreme heat and extreme smoke events. Outreach and engagement, which has gone live since March, and also we had additional pieces that went live in November with our housing benefit. That includes outreach and linkages to Medicaid and non-Medicaid benefits. It's some case management. It's support for people in making the connections they need across these different programs. Housing, which went live November 1st. We are just a little over a month into this. It's been a lot of work to get to that point, and our teams across the state, our CCOs, our housing partners have been hard at work to support this benefit. It is to support members who are trying to maintain current housing and are at risk of losing that housing. And then nutrition, which we're going to talk about today, and the benefits that will go live in January. Next slide, please. Okay, and with that, I believe I am turning it over to Julie Reeder, who is our nutrition lead.
Good morning, everybody. I'm Julie Reeder. I'm the Senior Policy Analyst with the Nutrition Benefit. Really happy to see the great turnout today and the interest in nutrition. And so what I'll share with you today are some a few things about what our underlying values were when we developed the nutrition benefit. And then to let you know that the nutrition benefit is a phased rollout. And as mentioned earlier on the last slide, we will be focusing on medically tailored meals and nutrition education for this first portion of the rollout. Next slide, please. All right, so let's talk a little bit about some of our core values in this nutrition design. Thank you. So the nutrition work group, and this was made up of essentially everyone who works in the nutrition field at the state level. So we had representatives from SNAP and from the Older Americans Act program, Home and Community-Based Services, myself from WIC and other programs. We really tried to center our work in thinking of food as nourishment. So not just calories and nutrients and micronutrients, but really thinking about food and all the way that it connects us. So it can be very powerful, connecting us to family or cultural traditions. I'm sure each one of you, if you had time, you'd have a special story about a food or making food that's really important to you. We see food and eating together as a way to help lessen isolation. Sometimes, it's a way to show your love, building memories together. As I mentioned, I think many of you would have a wonderful story about food or cooking together. For some of our populations, it's also a way to help reconnect yourself with your body's hunger cues and fullness cues. That may have been absent for a while. And it can be a way to improve your physical, mental, and health and well-being. But again, thinking as food as nourishment from a much more holistic standpoint. Next up. Other key principles and goals when we were putting together and designing our nutrition services is that we are really looking to provide services that are culturally appropriate and responsive. That really are person-centered and support autonomy. So being able to make choices, for yourself. We also really acknowledge, especially with food, that there is a big role of racism and colonialism present here, and that has in fact influenced what diets or dietary patterns sometimes are considered healthy or not. And so we really did not want to repeat some of those patterns by elevating certain diets or certain meal patterns as particularly healthier than another, because we know that across cultures, there are wonderful and healthy options. And we also really took a lot of time to look at the data. What do people actually buy? Where are the deficits and how can we help fill those in? We also took a good look at what other programs are out there. And again, where can we most fill the gaps? A couple of our goals for implementation was trying to use mainstream food channels as much as possible. So when I say mainstream, that also includes farmers markets, CSAs, farm stands, and so forth. But what that really is pointing to is trying to emphasize those regular sort of food acquisition channels rather than the emergency food system. Try to simplify how we deliver these benefits. So if there's a system that's already out there that seems to work, let's try to leverage that system versus making something brand new. And I think just in principle, trying to really make services that meet members where they are, right? Again, helping them to maybe renormalize if they haven't been able to go out and buy food, on their own for a while, or it's been very scarce. Help people connect with one another. And then just realizing that it takes time, right, to make nutrition and health changes, and giving people the time, place, and space to really do that. And finally, just really considering the lived experiences of those that we're focusing on for this particular waiver. And that's our piece. Next, please. Thanks. And finally, we really are focusing ourselves on having trauma-informed nutrition. Again, many people have quite a complicated relationship with food, and we really want to recognize that having experienced trauma of any kind during your lifetime can cause a disruption in having a healthy relationship with food. and or, food itself can be a source of trauma for some people. So we really are looking at creating a positive, healing relationship with food and the services that we provide. And so we went and asked ourselves when we were designing these services, the principal questions of trauma-informed nutrition. Does the food assistance reduce shame, anxiety, confusion, and tension? Does it promote safety, dignity, and joy? And does it inspire healing and a healthy relationship to food? And I hope as our services roll out over the next year, you'll see that these principles came into play. Next step. Okay, so let's talk about what is rolling out in January. So let's review the eligibility for the waiver as a whole, and then some specifics for nutrition services and medically tailored meals in particular. So number one, a person needs to be an active OHP member. So they need to be on OHP. They need to be part of one of the HRSN, health-related social needs covered populations, which we'll review in a minute. And they also really need to meet some clinical and social risk factors. For medically tailored meals, which we're rolling out, there are some additional clinical considerations that we need to take into account. So again, this is not an OHP member-wide benefit, but narrow somewhat due to the waiver eligibility. So who are the covered populations, right? So they're young adults with special healthcare needs. That starts in January when we roll out the nutrition benefits. Adults and youth discharged from residential mental health or substance use programs. Adults and youth released from incarceration. Individuals who are currently or have been involved with the child welfare system. People who are transitioning, and I just want to make that language clear, to dual status. So that means they are going to have or just recently have gotten both Medicare and Medicaid. So it's that transition period. And then those who are houseless, or just as the housing definition is, meet the at risk of houseless definition per HUD. So we are using the same definition and criteria for at risk of houselessness as is true for the housing benefit. Next step. So I know this is a complicated graph, and so I'll talk you through it. We're rolling out two different benefits here in January. And so one is nutrition education, and the second is medically tailored meals. For nutrition education, it's a pretty broad eligibility. So if you meet the waiver eligibility criteria, you have some clinical needs, and you also screen as having low food security per the 6-item USDA screener. Yep, I'll get to that in just a second. The 6-item USDA screener is having low and very low food security. You can qualify for nutrition education. So that's the top part here. The second benefit that we're rolling out with medically tailored meals are really for, again, you need to be in the waiver eligible population, right? But you need to really have a select number of health conditions that have progressed to the point where one might need medically tailored meals. And we'll talk about that a little bit more in a minute. You also need to have a full assessment and nutrition care plan from a registered dietitian, a licensed registered dietitian that indicates some need for medically tailored meals. Again, have to meet the USDA definition of low food security, and then you could proceed to request medically tailored meals. Again, we'll talk about this more because I know this is a challenging chart to go through, but I also know that some people really like a visual explanation as well. And I did note the question in the chat, and I'll come back to that. So I want you to think I forgot. So what is going live first? As I mentioned, the nutrition benefit that is for medically tailored meals really requires first a diagnosis, a condition that has progressed to a certain point where someone might really need medically tailored meals. I try to emphasize the medical and medically tailored meals, so it's not just a meal service, if you will. And besides having a diagnosis, and some people may need to start with their primary care provider and get a diagnosis, get lab work done, get other things done so we can know, where you are in staging this disease. But one of the key steps also is having a full assessment and nutrition care plan, and it needs to be with a licensed registered dietitian. And so this waiver allows a pathway to that and payment for that. If you are a licensed registered dietitian, and this is something that you're interested in taking part in, you would need to work with your CCO in your area or our third-party contractor for our open card clients to become a provider. Again, if this is you, we would be using the medical nutrition therapy codes, so 97802 and 97803, to bill for these visits. And again, if you are a licensed registered dietitian and would like to connect more on that, I'd be happy to do that with you. So just for the group as a whole, just understanding that the registered dietitian plays an important part in the medically tailored meals benefit assessment. Next up. So what about the medically tailored meals themselves? Yep, great question. We'll get to that, Brianna. So I think there's a couple of important things to keep in mind about the medically tailored meals that are running under the health-related social needs Medicaid benefit. And it may be a little bit different than what you're used to if you have households that are served by the Older Americans Act or home and community-based services, for example. So one of the key things to know is that per CMS, so the federal folks that we have this waiver with, medically tailored meals under this benefit are only available for the individual. So it is not a household level benefit. I know with the Older Americans Act and some other programs, the person's spouse, partner, caregiver is also able to receive a meal, and that is not the case with this particular benefit. So just something to keep in mind. It's not a benefit that can be used for people who are living in facilities, so think assisted living, other types of supported living situations that include meals as part of their package, essentially. It's also to be clear that this benefit, again, requires that people need to be in one of the covered populations. So that was the list that we went through before. Screen as having low food security per that 6-item screener, and also have the clinical risk. And so that may require, again, visiting with your primary care person, and then a referral to a registered dietitian as appropriate to put together a nutrition care plan. People can receive up to, and I want to emphasize up to, because people may not need or want up to 3 meals a day, 7 days a week. But that is a maximum allowable limit as appropriate and as desired for that particular person. And then it's just important to emphasize, if you're new to what medically tailored meals are, these are really menus and meal patterns that should be developed and approved by a registered dietitian. So it'd be knowing things like this person now needs to have this maximum level of sodium and this much protein, and we're going to up or lower potassium, for example. So they are pretty precise meals for people with serious and significant health conditions that need those supports. So if you are working with a household, depending on what type of work that you do, and you do see someone that has been great. So who has, a significant health condition that could be supported with some nutrition supports. They may have some limitations in their own ability to cook meals, shop, and so forth. Perhaps don't have a support person, or that support person at home has limitations as well. Would definitely encourage you to have that person connect with their primary care provider to see whether this might be a good option for them. So this is definitely a clinically connected benefit. And I see some excellent questions coming up in the chat as well. I can do nutrition ed and then lots of time for questions, if that's all right with you. Okay. Also going live in January is a nutrition education benefit. So this eligibility criteria is not quite as narrow as for medically tailored meals, because I guess I would say, well, we could all use some nutrition education, right? So if you are waiver eligible, again, need to be in one of the covered populations, be on Oregon Health Plan, meet some clinical and the food security criteria. You can apply, you can request to receive nutrition education services. We don't require you to participate in nutrition education to receive other nutrition services. And if you are an organization that is interested in doing nutrition education, what I would say is that we're looking for things that are sort of evidence-based or practice-based lesson plans or curricula that should be appropriate for the focused populations. So you might have something that works really good with moms and kids, but that may not be as appropriate for single adult males, for example. So it needs to be something that matches the groups that you'd be reaching out to. We can't reimburse for simply handing out flyers or recipes, booklets, and so forth. That wouldn't count as a nutrition education billable contact. I do want to clarify that because these are federal funds, we can't replace other federally funded programs. And so many of the nutrition education programs that are funded through USDA, so that includes SNAP-Ed, that's WIC. Of course, WIC is more than just nutrition education. And some of the OSU extension offerings that are out there, they may still be very, very appropriate options to encourage people to participate in, particularly, WIC for pregnant and postpartum people, children under 5. But again, many wonderful SNAP-Ed offerings as well. It's just something that we cannot pay for with the waiver. And a final reminder is that the diabetes prevention program, which many folks could benefit from, that's already covered by our regular Medicaid program. So that's something that wouldn't be funded here. So, but again, still a wonderful referral. And so if you starting in January, so it doesn't start until now, until January, so don't apply now. If you yourself or you're working with households that could benefit from these two services rolling out in January, you can, if you're on Open Card or someone is an Open Card or fee-for-service member, you can call and ask about further screening and connection to these services. And if you are working with someone or you are enrolled in a coordinated care organization, you can go ahead and reach out to your CCO. And we will have many resources coming up on our OHA pages, fact sheets, eligibility criteria, and so forth for this, as well as some communication pieces for healthcare providers and health system folks who might be working more with members who could qualify for medically tailored meals, noting that that's a clinical service. So, and with that, I know we already have some questions in the chat. So open it up.
Question, Julie, would you like me to start reading these out loud so they're included in the recording, or do you want to just take it and run? Either way.
yeah, I'm happy to either way, whatever you prefer.
Let's see here. And I think, well, you can also let me know if you're like, I already answered that, because I just want to make sure and do due diligence.
Sean has answered a few.
I believe I will then reiterate then. So the nutrition benefits can be provided to people who are at risk of houselessness and also who are houseless. I'm going to affirm that.
Yes, here's what I would say though. I think for medically tailored meals, you are going to need to be able to safely store and reheat those meals in most cases. So that may not be an optimal choice for houseless individuals. So I want to be honest about that. But yes, they would be eligible for nutrition services if you're houseless or at risk of houselessness.
Thank you. There's a question about what pathway people need to go to get the RD assessment or how people can self-refer. I'm sure you have, I just want to see if you want to say more about it.
Yeah, so you certainly can self-refer. I think this is one where it depends where you are in the pathway. Per se. So if let's say you just call up and you don't have any sort of diagnosis or indication that you would need medically tailored meals, and I imagine we're mainly talking about medically tailored meals here for a second, you may need to connect with a primary care provider to, see if that's a correct diagnosis, maybe see where you are in progressing with that disease, and then likely get a referral from your primary care physician to see a registered dietitian, who then would hopefully put together a nutrition care plan for you, which might or might not include medically tailored meals, sort of depending on what your needs are, what the status of your disease is, limitations and supports at home, and so forth. Yeah.
I see a question about who is responsible for the USDA 6-item screener, and an answer that this would be if someone is on a CCO, their CCO. If they're on Open Card, then Open Card. And there's a follow-up question. There's actually a few. Is the CCO also responsible for ensuring that someone is HRSN eligible
Yes.
for the social? Yep. I will read it all just for the recording's sake. I'm slowly realizing. They must also meet the social clinical risk factors and are in an eligible population. So yes, that all is with CCOs or Open Card. In addition to the assessment. And a question, let's see here. Requirements to the curricula, do they need to be, I might lack the language to say this well, Julie, my apologies. I think this is more about education since it's a curriculum being discussed. The role of OHA in that.
Yeah, so we have provided some criteria or things to look through to the CCOs. I'm just making a written form with that. Questions to ask about proposed curriculum. And so we're looking for things like, does it have a name? Who is it targeted to? What is the evidence or research, or what is the knowledge that it pulls from? How often is that updated? How are the folks that teach that curriculum instructed? What is the training piece for them? For example, are there any even basic evaluations that attendees do? And how are things modified accordingly based on that feedback? So that's the short list, but basically looking at, where does the information come, that you're sharing and teaching? Is it current, up to date? Is it appropriate, for that particular audience? That's in a nutshell. And I'm happy anyone who's really interested in extra details, that would be the case. And not something that's reimbursed by other sources or funded through other sources. So yeah, Brianna, did you want it? Brianna? Go ahead.
Hi, sorry, I didn't mean to jump around, but I just wanted to that initial question I was asking on the referral and where it kind of needs to be driven from. It sounds like it can kind of come from anywhere, right? But that there may be the need for a PCP to get involved if there's not enough information.
Correct.
I guess I'm just thinking about like the member experience and what the expectation is. So it sounds like it may differ from CCO to CCO on what they are going to require for that individual, or like if, like, so we're a medically tailored meal provider. Like if someone came to us, could we assist them in filling out a referral? And then I guess what would we tell them? You know what I mean? Like, what happens next? I just want to make sure that we have good, accurate information to share.
So you could certainly, again, point them back to their CCO to go through that, because likely you wouldn't have the information about whether they're in a covered population or not, and the
Yes.
things. So certainly let them know that's wonderful that you're really interested, and here are some ways to connect with the CCO. That's my short answer. And I think as you are indicating, people will be in different steps, in this. We could have some people who, really have all of those pieces together, have already been working with a registered dietitian and just don't fall into any of the other categories that could get these meals paid by the Older Americans Act, or, home and community-based services, or Medicare. So
Okay.
looking to fill in that gap there. Does that help?
Yeah, so I think it sounds to me like we can submit a referral or assist them in submitting a referral, direct them to submit a referral request for MTM, and then kind of the CCO would take it from there. And so
Yeah.
that would just be like next steps, you'll want to make sure to answer your phone if they're going to call you, or, kind of be ready for anything that might happen next. And there could be additional steps required in order to get to the assessment that would be next
Yeah.
prior to
And I
the
might phrase it like you're putting in a request to see if MTM might be a match for you, because again it may not be what if you're in the covered the waiver covered populations, and whether MTM might be a match for you.
Okay, great. Thank you so much.
Depending on where you're starting in this.
Sure.
Okay, thanks. What else?
See, we have a lot of great questions. I'm trying to go in order. I may be able to group a couple of these. So I think there are some questions that are around how people can best screen themselves, or how to best determine if they are eligible for this.
Yeah. Well, I think that may be challenging for you to screen yourself in some aspects. You could certainly look at what the waiver criteria, are, if that makes sense. And so you could do that. I think though you would probably really need to connect with your primary care provider. Think about what this health condition is. So for example, many people have type 2 diabetes, but most people who have type 2 diabetes, right, would not need medically tailored meals, for a long time. So it'd be looking at, does this person now have, and again, these are just scenarios, have kidney disease to the point where they maybe are needing some special diet considerations, and don't have a lot of support, at home, or have some limitations themselves in cooking and prep.
I imagine going to your CCO and going to OpenCard are also great ways in.
Absolutely. And they will help you navigate some of those things. Yeah, Brianna, did you have anything else? Just wanted to make sure. Okay. Your hand was still up. So go ahead, Jessica. What else do you have?
All right, we have a few, so we have a few more eligibility related questions around things like if people have received rental utility assistance, can they also apply for nutrition supports?
Yes.
And then details within nutrition benefits. For example, is there a time frame by which, like, how many meals and for how long can people potentially get?
Yeah. So as I mentioned, it can be up to, and I want to emphasize the up to, right? 3 meals a day, 7 days a week. Again, it's not everyone may need that or want that. And it's for 6 months.
And
Up to.
questions to learn more about the meals, which I'm not sure how much detail we can give in this setting. They are prepared meals. Are they ingredients or menus?
They are prepared meals. So they're not a grocery. If someone's asking it in that way, they're not a medically tailored grocery.
Are we providing people with food other than through medically tailored meals?
Later, when the rest of the benefit rolls out, we'll be starting with the fruit and veggie benefit and then move to pantry stocking. But that'll be, hopefully the fruit and veggie benefit for the height of our local produce season and then pantry stocking thereafter. So at this time, it is medically tailored meals. And so we recognize, some limitations there, but at the same time, we're really trying to focus on our absolutely most vulnerable populations. And fill that gap for those who really need those supports. So, yeah.
I think a lot of these questions have related to that idea of how are the meals getting to people? What do they entail? We answered the grocery portion. Is there anything more that you want to say about the delivery across Oregon, maybe in some of those areas that may be served by fewer options?
Yeah, so there are existing home delivered meal locally and national, medically tailored meal providers. It's sort of I won't say a handful, but they have approved menus, and so they may be able to provide things that align with standards for a cancer pattern or a puree pattern, lower sodium, heart healthy, things that are specific to different stages of kidney disease, for example. And so those meals come prepared and are home delivered to people in general. I'm speaking in generalities because there are some differences between but that's the case.
I think another category of questions are people wanting to know more about the process by which their curricula can be accepted and more details there for providers.
Yeah, I think if you have individual questions, I'm happy to chat with you. Also recognizing that you need to be, connected with the CCO or signed up with us as a fee for service provider in order to bill for this. So I just want to, also make that piece clear that you can't just run the class and not be signed up to be an HRSN provider.
Great point. And there's a separate set of resources that I believe we can find and furnish in the chat around the logistics of becoming a provider versus the logistics of providing nutrition services.
Yeah.
And Sierra, I see your hand.
Yes, excuse my voice. I'm getting over a cold, so sorry about that. Let me know if you can't hear me. I just thought it'd be easier to come off mute instead of throwing this in the chat because it's a little maybe more complicated of a question. But I have a particular participant that's in the HRSN program that I'm working with. And they mentioned that they are on a liquid diet. And I'm wondering if this nutrition program can kind of accommodate those specific needs. They have a lot of medical conditions and are undergoing many surgeries, and they are only on a liquid diet. And so I'm not sure if this program can kind of accommodate those specific needs.
Boy, Sierra, I think that's a tough question. And I think we need to follow up with you more, like what, in terms of what do we mean by a liquid diet? Liquid diet to a point where maybe something is covered under pharmacy. Are there DME aspects to it as well that could be covered under regular? Are you more talking that they're on broth? And that sort of, I guess this probably perhaps is more than we could go through here for that particular person in that particular case.
Yeah, of course. Maybe I could provide an email,
Sure.
and then we could follow up later, maybe, because I also don't have the questions you're asking, I don't think I have the answers from the participants, so I would have to probably follow up with them as well.
Yeah.
But I would love to reach out again to get some clarification if that's okay.
Sure. Yeah. Sorry about that. I just think there's so many clinical details.
Yeah.
It's hard to sort out and what
Yeah,
might
thank
be. I
you.
mean, in the end, we want people to get what is the best, most comprehensive service for them, right?
Mhm.
Clinical needs. And so will this be it or not? Let's talk that through. Thanks.
Let's see here. There were some questions around anything we can tell folks about the timeline on the additional nutrition services that we'll be rolling out.
Yeah, again, hopeful for the fruit and veggie benefit by the market season, essentially, the market season, and then hopefully the pantry stocking benefit later on. So we don't have an exact timeline for pantry stocking at this time, but we will update you as soon as we do.
I see that Shauna Care put in contact information for Julie and Shauna at just about the exact same moment someone asked if there's a good email providers can use for questions around nutrition. So that was, I love it when it works out that way. I know there are more questions. There are some around medically tailored meals, specifically around these are specific enough that I may require help. Around if considerations for people who do not have the dentition to eat a lot of fruits and vegetables, and questions about after that 6 months, what are the expectations?
Yeah, and so I think that's where care coordination is going to be really key, right? And thinking a lot about that nutrition care plan for folks and how you are using these medically tailored meals and what way that you're supporting that person. Do they then move on to different types of supports? I think that's challenging without really understanding that individual's clinical condition. But definitely thinking a lot about this, updating the nutrition care plan, updating care coordination based on where that person is after that time period. So
I want to group together two comments and or questions specific to serving population. Oops, sorry, the comments scrolled while I was talking. Working with developmental and intellectual disabilities, and there was one comment about when something is provided to an individual but not to their whole family, there are complications, and that is harder to make work for that family and that individual, as well as if people are very particular in what they eat, are MTMs able to be tailored for situations like that?
yeah, I think to the extent, again, I think that's great to work with your CCO and that particular medically tailored meal provider, but there are, varieties of foods and certainly can work with you to do that. I do acknowledge that this is difficult in a household setting. And that's why I was very, upfront and transparent about that difference in this particular benefit.
And another theme for questions that I can definitively say is yes, these slides in this recording will become available. Absolutely. I did see, can someone apply for multiple health-related social needs benefits? Yes, the answer is yes.
Yes.
Okay, all.
Yep. And we do have multiple,
okay.
people are shouting out their MTM programs. So we do have multiple groups across the state that will be providing this. But just to emphasizing again that it really starts with your request to the CCO or your request to Open Card. And again, some people may need to start with their PCP just to get diagnosis and staging, get that nutrition care plan put together. So absolutely.
And the recordings all go on our public site. It hides under our newsletter updates, but I do believe we also send a follow-up email to all of our participants each month. And so you will have access to that as well. And every time we send a new email out for the next month of our AllCom webinar, we put all the resources from the last couple of months in that email as well. So there should be a few ways to reach it. But if, say, a week or two have passed and you haven't heard from us, that central waiver inbox is a great place to double check, make sure we have your information correctly, and make sure we are communicating well with you. Let's see here. I have a question about, will each CCO have their own form to apply? And how can people best apply?
Yes, there is a form. Each CCO has forms. Shauna, did you want to pipe in on the request forms? They're not up yet, but
Oh, they will be up on January 1st for folks to be able to self-refer. And then can always call your CCO or open card for that process.
I have a question that I might know just enough to be dangerous here. I do know that there are climate, health-related social needs, and housing, HRSN forms that are currently active. Would taking a look at those just help give people an idea for what it may look like, or do you think it's going to be significantly different?
well, certainly look at any form that you wish. I think especially for it may help, but for the very clinical nature of medically tailored meals, it may not be a perfect fit. And again, if you're calling and requesting, or you're filling out the forms that will become available in January, you're really sort of requesting to get this process started, right? If you will, to get that assessment piece in wherever you may be in that process, if that helps.
We also had in that series of questions around who can submit paperwork on someone's behalf. A question was specifically social worker. Can you speak to that?
Yeah, so you certainly, if we're talking about the request form, it depends what kind of paperwork we're talking about. Certainly, anyone can help, and with submitting a request or helping make the phone call, right, to the CCO or the TPC. It could be, certainly depending on where you are in the health system. You could also be helping people pull together the clinical documentation, paperwork, nutrition care plan to move forward with the medically tailored meals request. I hope that answers
Good distinction. Thank you.
that question. Yeah.
A question about where people can find what organizations are providing what services. And I think the answer is probably we would point people towards their CCO since they are maintaining their own networks.
Correct.
And a question about if all organizations will be open on January 1st for this go live.
Well, people can come in with their requests, but I wouldn't say, and you'll be getting a medically tailored meal January 1, right? Remembering that this will take a bit of time, right, to process. So yeah, Brianna, I don't want to say.
Oh, it's Brianna, but that's okay. Either way, you could just say Bree. That works too. Just out of curiosity, I think you mentioned that you'll have a request form on your site as well. If a request, and maybe I missed this, I think the CCOs will also have request forms on their own sites, maybe 211, other areas. If it makes sense if it's on their own site that it would go to them, but if it was on your site, will it just have the CCO on there, or how would that have distributed if it was going through
Did
you
you want
guys?
to clarify that, Shauna, sort of what our page has and doesn't currently?
Oh, absolutely. On January 1, the page will, let me try to turn on my camera here. So sorry. Our OHA page will have the OHA request form to where someone can fill it out, print it out, scan it in, send it in, that type of thing. Provide it to their CCO or to OpenCard. They can also call, and on our website by January 1st, we'll also have all the different CCO websites and their contact contact information to where it'll be real easy to be able to click on and get to those individual CCO health related social need request forms for nutrition or climate or housing, whatever they may need.
Okay, so you'll have the forms there available for them to provide to their CCO and direct links to the CCO as well. But nobody would submit anything to you. You'd be directing them where to submit that information. Is that right?
Right. Yeah, all that information will be on there. If we do recommend if they are with a CCO that they utilize a CCO form. They don't have to. But all that information will be collated on our website and launched for the January 1st launch. And I also did see, and I think that Julie mentioned this also, that folks can request on January 1st. It certainly takes a process. We know that businesses will be slim on the holiday area time frame, but they can certainly go ahead and request those services and might not get a response on January 1st, but certainly soon after.
Thank you so much.
We have had an extremely active chat, an extremely active group of folks here. I want to thank you all. I want to make sure we are able to get through our final bit of closing content and honor your time for this is a 1 hour event. Is it all right if I move us through the final slides and then I could try to stick around for a couple more minutes? We do have everything that is in the chat. And if you want to put additional things in the chat, we do save this and we will use the chat to help us with future content and with connecting people where we can. All right. I'm going to go ahead and say next slide, please. We are continuing to have webinars. Our next one will be on January 8th, and the topic is Benefit Update Project, which is going to be a little different from our health-related social needs content, but also a very important topic about how this round of the 1115 waiver is reshaping Oregon Health Plan here in Oregon. And so look for an invitation very soon, but also the link you use to get in today will get you into that meeting as well. Next slide, please. In addition to the more personalized information in the chat, which I'm not going to say out loud because this becomes a recording. And so if you are watching the recording, then we highly recommend using this centralized inbox for reaching out to us. That's the 1115waiver.renewal@odhsoha.oregon.gov. And that goes to a centralized place, and then we will find the right people within OHA to connect with you. We also have a lot of great information on our website. The one that is mentioned here on this slide is our general one, but there are also specific health-related social needs pages in addition that you can navigate to from that main page. This URL here is also a great way to find things like the recording for this and our newsletter information, a lot of other information. But if you want those newsletters to come more proactively to you, you can sign up using this GovDelivery link. That is the final thing on this slide. As always, we are so grateful that we have such a great group of folks who want to continue to engage with us, build with us, learn with us. And so I think the final slide is our slide for gratitude, if I remember correctly. Yes. It's 10:59. We made it just in time. Thank you so much for being here today, for continuing to show up, and for our shared commitment to serving folks in Oregon. Thank you so much, Julie and Steph, for your presentations, and we hope you all continue to join us. Thank you. Have a great day.
Thank you.
Thank you.
We can go ahead and end the recording as well.